Hyaluronic acid is also known as hyaluron. It's a clear, gooey substance and it's naturally produced in the body. The largest amount is found in the skin, the connective tissue and the eyes. Its main function is to retain water and to keep your tissues lubricated and moist. It has a variety of uses. Many people take it as a supplement, but it's also used in topical serums, eye drops and injections. Hyaluronic acid supplements can help your skin to look and feel more supple. Roughly half of the hyaluronic acid in your body is present in the skin, where it binds to water to help to retain moisture. However, the natural aging process and exposure to things like ultraviolet radiation from the sun, tobacco smoke and pollution can decrease its amount in the skin. Taking hyaluronic acid supplements can prevent this decline by giving your body extra amounts to incorporate into the skin. Doses of 120 to 240 milligrams per day for at least 1 month have been shown to significantly increase the skin moisture and to reduce dry skin in adults. Hydrated skin also reduces the appearance of wrinkles, and this can explain why several studies show that supplementing with it can make your skin appear smoother. When applied to the surface of the skin, the hyaluronic acid serums reduce wrinkles, redness, and dermatitis. Some dermatologists even inject hyaluronic acid fillers to keep the skin looking firm and young. Hyaluronic acid also plays a key role in wound healing. It's naturally present in the skin, but its concentrations increase when there's damage in need of repair. It helps the wound to heal faster by regulating inflammation levels and signaling the body to build more blood vessels in the damaged area. Applying it to skin wounds has been shown to reduce the size of the wounds and decrease pain faster than a placebo or no treatment at all. Hyaluronic acid has antibacterial properties, so it can help to reduce skin infections when applied directly to open wounds. It's effective at combating gum disease, speeding up the healing after tooth surgery, and eliminating ulcers when used topically in the mouth. While the research on hyaluronic acid serum and gel are promising, there's been no research to determine if the hyaluronic acid supplements provide the same benefits. However, since oral supplements boost the level of hyaluronic acid found in the skin, it's reasonable to suspect they can provide the same benefit. Hyaluronic acid is found in the joints, where it keeps the space between your bones well lubricated. When the joints are lubricated, the bones are less likely to grind against each other and cause uncomfortable pain. Hyaluronic acid supplements are helpful for people who are suffering from osteoarthritis, a type of degenerative joint disease caused by wear and tear on the joints over time. Taking 80 to 200 milligrams per day for at least 2 months has been shown to significantly reduce knee pain in people with osteoarthritis, especially those between the ages of 40 and 70. Hyaluronic acid can also be injected directly into the joints for pain relief. However, an analysis of over 12,000 adults found only a modest reduction in pain and a greater risk of adverse effects. Some research shows that pairing oral hyaluronic acid supplements with injections can help to extend the pain-relieving benefit and increase the amount of time between the shots. New research shows hyaluronic acid supplements help to reduce the symptoms of acid reflux. When acid reflux occurs, the contents of the stomach are regurgitated into the throat, and this causes pain and damage to the lining of the esophagus. Hyaluronic acid supplements can soothe the damaged lining, and they can speed up the recovery process. One test tube study found applying a mixture of hyaluronic acid and chondroitin sulfate to the acid-damaged throat helped to heal it much faster. One study found that taking a hyaluronic acid and chondroitin sulfate supplement, along with an acid-reducing medication, decreased the reflux symptoms 60% more than taking the acid-reducing medication alone. A second study showed the same type of supplement was 5 times more effective at reducing acid reflux symptoms than a placebo. Research in this area is still relatively new, and more studies are needed to replicate these results. Approximately 1 out of 7 older adults suffer from the symptoms of dry eye due to reduced tear production or tears evaporating too quickly. Since hyaluronic acid is excellent at retaining moisture, it's often used to treat dry eyes. Eye drops containing 0.2 to 0.4% hyaluronic acid have been shown to reduce the dry eye symptoms and improve the eye health. Contact lenses that contain slow-release hyaluronic acid are also being developed as a possible treatment for dry eyes. In addition, hyaluronic acid eye drops are frequently used during eye surgery to reduce inflammation and speed the wound healing. While applying them directly to the eyes has been shown to reduce the dry eye symptoms and improve overall eye health, it's unclear whether oral supplements have the same effect. New research on animals has begun to investigate the effects of hyaluronic acid on bone health. 2 studies have found hyaluronic acid supplements can help to slow the rate of bone loss in rats with osteopenia, the beginning stage of bone loss that precedes osteoporosis. Test tube studies have also shown high doses of hyaluronic acid can increase the activity of osteoblasts, the cells responsible for building new bone tissue. While its effect on human bone health has not yet been studied, early animal and test tube studies are promising. Approximately 3 to 6% of women suffer from a condition called interstitial cystitis, or painful bladder syndrome. The disorder causes abdominal pain and tenderness, along with a strong and frequent urge to urinate. While the cause of interstitial cystitis is unknown, hyaluronic acid has been found to help to relieve the pain and the urinary frequency associated with this condition, when inserted directly into the bladder through a catheter. It's unclear why the hyaluronic acid helps to relieve the symptoms, but researchers hypothesize it helps to repair the damage to the bladder tissue, making it less sensitive to pain. Hyaluronic acid is generally very safe, and there's few reported side effects. Since the body naturally produces it, allergic reactions are very rare. One study in 60 people with osteoarthritis who took 200 milligrams per day for 1 year reported no negative side effects. However, its effects during pregnancy or breastfeeding have not yet been studied. There's also some evidence that cancer cells are sensitive to hyaluronic acid, and taking supplements could make them grow faster. For this reason, it's generally advised that people with cancer or a history of cancer avoid supplementing with it. Hyaluronic acid injections into the skin or the joints have a higher risk of side effects. However, negative reactions are mostly associated with the injection procedure rather than the hyaluronic acid itself. Hyaluronic acid supplements can safely be taken by most people, and they provide many health benefits. It has well-known benefits for the skin, especially alleviating dry skin, reducing the appearance of fine lines and wrinkles, and speeding up wound healing. It can also help to relieve joint pain in people with osteoarthritis. Other notable applications include hyaluronic acid eye drops to relieve dry eye, and inserting hyaluronic acid directly into the bladder via a catheter to reduce pain. Overall, it's a beneficial supplement for a variety of conditions, especially those related to skin and joint health. For more on herbs, supplements, and natural treatment plans, check out my website.